Welcome to the Hanley Effect, a podcast by the Hanley Foundation designed to educate, change minds, and save lives. Our goal is to inspire you, showcase our innovations, and change the conversation about addiction and mental health. Join us as we unravel stories of resilience, recovery, and hope.
Well, hi, everybody. Welcome to the Hanley Effect. I'm John Dyben, and it is just me today, but I'm super excited for our guest. Today, we have Amber Hollingsworth. She's joining us. She is both a licensed professional counselor and a master addictions counselor. And for over 2 decades, Amber has been spending her career and her life working with individuals and families who are impacted by addiction. And she's also, over the past years, spent a lot of time. Many of you probably have seen her online or are familiar with the work that she does in reaching people through social media and through video and through podcasts. And so we're just super lucky to have her today. Amber, thank you so much for being here today. Welcome.
Thank you for having me. I'm excited to be here.
Me too. We were just talking about where we're at, and I'm in South Florida, and you're in South Carolina. So
That's right.
we're about, I used to say that I'm from the South, but I have an aunt from Georgia who made it very, very clear to me at a young age, South Florida is not the South. It's a part of New York City that broke off and like floated down and attached itself.
It's
But
its own territory. Okay.
It really is. Well, it's great to have you. What do we love to do? We love to ask our guests 2 things right at the start. We love to ask you to tell our audience about you, tell us who you are and what you do. And then, as much as you're comfortable in sharing, what was your journey that got you to doing what you do today?
Oh, absolutely. So I am by trade an addiction counselor specialist. That's what I've done for 20 plus years that I've been in the field. And I think the thing that's maybe important to know is, and this isn't that different than many addiction professionals, but almost all of the people who've seen me over the years didn't want to see me or didn't think they had a problem or thought they had a problem, but they didn't need to talk to anybody about it. And so I've been working with people in various levels of denial, reluctance, resistance, whatever you want to call it, for my whole career. So over those bunch of years, I've developed pretty good skills at engaging people. In fact, when people come in now, they don't want to see me. I like it because I feel like it's a challenge. I'm like, I got you. Give me 2 sessions, And so it doesn't even bother me when people say, well, I don't really want to be here. I'm like, all right, we'll see, And I've just gotten this skill set about engaging people and helping to motivate people to make the changes that they need to make. And so a lot of my content that I create online is actually geared towards the family member instead of the addicted person, even though my work has been with the addicted person. And I try to help family members understand the psychology of what's going on with their loved one and how to get through their denial and how to get them motivated to change. Because, people say you can't make someone change. And I say, I agree, you cannot make someone change, but you can make or influence someone to be motivated to want to change. And so that's sort of my specialty is how do you get someone to want to change? And that's what a lot of my content's about.
I love that because, there's this old idea and you've been doing this work as, we've been doing this work long enough to have probably been told or taught or trained at some point, you got to hit rock bottom or you can't help someone until they want to help themselves. But then we realize that we deal with a disease that actually hijacks people's ability to want to help themselves. And so, there is that your approach of saying, the old idea was you can't help somebody till they want it. So if they don't want it, don't do anything. And you're rejecting that idea.
I'm rejecting that idea completely. I feel like family members get told so often, there's really nothing you can do. They have to want it for themselves. Basically, you're just going to have to step back, hope they hit a bottom, and decide they want to get sober, cross your fingers. And when this is like your spouse or your son or your daughter, that's not acceptable. And people want more than that. And when they want more than that, they get told to go to Al Anon. And there's nothing wrong with Al Anon. Love Al Anon. And it's great to help support that person. But people want active steps. What do I say? What do I do? How do I say it? When do I say it? And so my work is trying to help raise the bottom. We work a lot with people who are what I would call like highly functional addicts and alcoholics. I know that's not a clinical term,
Mhm.
but we all kind of have an idea of what that means. And how do I
We
get
all know
someone to
what that
want to
means.
change before they blow up their life, before they
Right.
burn every bridge and lose everything? Because I think when too many consequences happen, it's really hard to bring people back from. So there's kind of an optimal level in there.
Can be its own downward spiral. Well, in a second, I'd like to talk a little bit more about how you do that work with families. One of the things that is not only I find, I'm not sure if you find this as well. Not only is do the patients who are afflicted with addiction saying I don't need help, but a lot of times when we reach out to families, families will say, you know what, that's their problem. I don't need help. And we come from a perspective that says everyone deserves recovery and everyone's affected by it. And so I'd love to talk a little bit about in a minute about how you actually do that work with family and with patients. But what what brought you to this? What brought you to this work?
Well, John, my answer to that is not nearly as exciting as most people's answer to that. Most people that are in this field because they have a personal experience with addiction and their heart is led and they get in the field. And I landed here by accident. Now, so
I
I'm
love
not in
that.
recovery myself. I'm definitely addictive personality, as in I do everything excessively. I just never really got into the substances. And that's because I came from an addicted family, like grandparents, parents, all the step parents, and there was a bunch of them, aunts, uncles, cousins, like hardcore, like my mom was doing meth with my sister hardcore. Um, and people would say, "Oh, well, that's the reason why you're in the field." And I wish I could say yes because that's kind of a more romantic kind of answer. But the
Right.
truth is, I didn't realize how addicted my family was until I was already in the field. Because when you grow up in it, it feels normal. So it wasn't like that inspired me to get in the field, but I do think that it helps me in my work to have some understanding about what it's like. And to be honest, even though my family had severe addiction issues, still feel like my grandmother was great, even though I have no memory of her without a glass of vodka in her hand. I have 0 memories, but my Mimi, she's my Mimi, was wonderful, and I wouldn't give anything for her. And so I feel like these things give me the capacity to see that someone can have a problem, but that's not all of who they are, and they can still be really great at all these other things, and I can see both things at the same time.
Oh my gosh, I love that, and I share a similar story, in that is, we were, and if you've been in this field about 22 years. I came here to Hanley Center 22 years ago in 2004. 22 years ago, we were, someone who was not. In recovery from addiction to be dedicating their career to addiction treatment was very, very unusual. We were a bit of
Yeah,
it was
who would do that? Right? A glutton for punishment.
right.
Right, yeah.
And now you see a lot of people now. You have to have classes on addiction in your graduate studies, whereas 20 some odd years ago that was unheard of, very unusual.
Mhm.
And so I see a changing field and people coming with backgrounds in recovery, and without that coming to this. And it's so interesting. But what I love about it is that there is sometimes I think that is kind of romantic and beautiful because it there is this perception that you and I would have had, and people would have looked at us askew, even in the especially working in residential treatment and such 20 some odd years ago.
Mhm.
But the reality is that healthcare, if we're dealing with a disease and we are treating health conditions, I think having a variety of perspectives is incredibly valuable. So I love that story, and I think it's
Yeah,
beautiful, and I think it brings the beauty of being able to see Mimi as more than just the person with the drink.
right.
And I when I think about families, one of the things, when families see someone they love fall into addiction and get captured by addiction, it's easy sometimes to almost think of them as the addiction. And it's so hard to help people sometimes separate and say your loved one is still there and they're afflicted by the addiction. Uh,
Mhm.
I see you nodding, and so I'm really interested in kind of how you approach the work. How do you approach this work both with the patients and helping them, lift that bottom, and also how do you approach the work with families?
Well, let's start with the families, and I'm gonna tell you my tricky little secret there, okay? Um,
Yes.
so when I went out into private practice, it just became more and more and more clear to me that if I didn't get these families on board, they were sabotaging the work I was trying to do with their loved one. They didn't mean to. I mean, they were trying to help and support, but honestly, they were just making my job 100 times harder. So I was like, I got to do something. But when you talk to a family member and you say, well, I can help you, or let's get you some appointments, that can be kind of offensive up front, right? Because it can be like, well,
Right.
I don't know what you're talking about. I'm not the one with the problem. They're the one with the problem. If you fix him, I'll be good. You know, that's sort of the attitude you get, which is totally valid and justified. So I got a little bit sneaky about how I said it. So I'm going to tell
All
you
right.
my
I
sneak.
won't tell anybody. Go ahead and
Okay.
tell me. I
Okay.
won't
Don't
tell
tell
anybody.
anybody. And this works. I said, so I can work with your loved one, but I'm gonna need you to come up here and see my colleague for the family part because they're not gonna tell me the whole story. They're not gonna tell me the truth. And if you're not up here, I'm probably gonna fall for half their junk like the last 10 people did. Man, they'll come up on 2 wheels squealing to get in your office. And that's true. That's not a lie, right? That's sort of half of it, is I
Yes.
do need the whole story. So it's not like I'm not true about that, but they can see the need for that.
Yeah.
And so they're totally on board for that almost all the time.
That
So that
makes
was my secret about how I
complete
did it
sense.
then. Now I do it on YouTube, and so they just find me naturally and come to me, but that's the way I did it back in the day.
Well, and it is true. It's like you said, it's a little sneaky, but it really is true, and it hits on something, as the family member, right? I I I I the invitation not only to help make things better, but there is something about I want to hear your story as the family member, and I want to give you a chance to share your experience. And
And
it's
I
it's
care what you
powerful.
think, and I trust your
Yes.
judgment about what's happening.
Yeah.
If somebody's mama comes in and says, "I know they're using," they could come in and pass a drug test for me, but I'm probably gonna, believe, because this your kid or your husband or your wife, them like the back of your hand. So, to feel like, okay, they care what I think and they want my pieces of information, that can feel good. But if they perceive the message as, "There's something wrong with you and you're causing this," or whatever, that can feel offensive. So it's about how you frame it, and that kinda goes into how I work with people with addictions. It's all how you frame it. It's
Right.
all, how you're packaging what you're trying to communicate to people, and it makes all the difference.
Right. So your experience going thinking about how your all your work, and I know I'm gonna ask you about the patient part of it in a
Mhm,
minute, but you've experienced working in treatment facilities,
mhm.
and you've experienced working in private practice. Can you talk a little bit about how those are different and where I mean, what are some of the advantages and disadvantages for, being in a treatment center as opposed to being in a private practice?
Well, the first half of my career, the first 10 years or so, I worked in an inpatient facility. Now they had intensive outpatient, they had partial hospitalization, but they had like 5 different inpatient units. So you had like severe mental health, you had the depression sort of ward, you had the detox ward, they had adolescents, they had geriatrics. So really got to see very up close a lot of different things, and I wouldn't give anything for that experience because there's some things you just have to see it to understand it. And when you have people inpatient particularly, you're seeing it play out because a lot of things you see play out in the relationships between the people when they're in a group on a unit. You're like, okay, now I can see what that is and how that works. Um, I I had a great experience doing that. The first gig I got was they wanted me to develop and run an intensive outpatient program for teenagers with chemical dependency. I didn't know what I was doing. I was a baby right out of counseling school, and like you said, they don't teach you all this addiction stuff in school like they did.
Right.
I have one class on addiction specifically, and that involved go to some meetings and write a report and tell us what it was like. Like
Right.
literally, that's it. And so I was in over my head, but I wasn't going to admit that. I wanted, it's my big girl job. I wanted to keep it, so I said absolutely. And I jumped in there 2 feet into the deep end of the waters. It doesn't get much deeper than teenagers with chemical dependency,
Amen.
right? And I had such a great experience. I did that for years, and everything I do now, I probably learned from that particular piece. I also worked in detox. I was a patient advocate. I did everything in that hospital over 10 years. I say working in detox is kind of like addiction counselor hell. And
Why is that?
because
Tell me.
you're like talking to these people, like maybe there's 12 of them in a room, 2 of them are awake, one of them's rolling their eyes, one of them's mad, and you're like, I went to school for this, I'm joking,
Hmm.
but it's rough, and you can get burned out with it really quick because it's a lot of revolving door. It's a lot of, people are in detox. They're stabilizing. They're not even really like in a place to be doing the like work, the emotional,
Right.
psychological work. So I'm glad I have the experience, but I'm glad I'm not doing that anymore. That piece.
We remind people nobody comes to see us on their best day.
Right.
Um, People come to see us on their absolute worst day, and when they're in that initial fit, and for anybody who's not familiar, who's listening or watching, who's not familiar with addiction treatment, it almost always starts out, especially if it's a residential level of need, you're going to start out in a medically managed detox, because detox can not only be coming off of drugs, can not only be uncomfortable, in some cases it can be dangerous if you're not medically managed.
Uh-huh.
And man, those first days, even if the Hanley Center has our medically managed detox, and we have very similar, those multiple different programs and units, and it's all on one campus, and it's nice and lovely. But no matter how great it is, detox is not a fun moment. And the counselors and the therapists out there that do that work, it is a very special person to be with people in the worst moments of their worst moments.
Spot on. Couldn't have said it better. Absolutely. Yeah. And then
Now,
when I got in private practice, um, I because people knew me for addiction, so people wanted to send me their addicted loved ones. Well, what would happen would be I would get these phone calls all the time, which would be, I really want my daughter to come see you. I really want my husband to come see you, but they just refuse them. Like, they don't think they have a problem. How am I going to get them in there? So it was one of the first challenges that I had to overcome is I had to help people help their loved one to even get them in the door, whether that's to me or to someone else. Maybe they needed
Mhm.
inpatient treatment or something. And so I would guide these families on how do you do that before you can even get them to sit in front of you. There's some like pre-steps in there that people needed help with.
And can you talk a little bit about that process? So how do families that are listening now and that are going, well, what do you do? How do I talk to my loved one?
Sure. At that time, I was specifically focused on how do you get them to like come into the office. And I gave them the words to say, which was, hey, we've been arguing about this a lot. I know I'm not handling it correctly, and probably I'm making everything worse. And I think we need to go figure this out together. So instead of saying, you have a problem, you go get help, you're saying, hey, I know I'm a piece of this. Let's go figure this out together so that I can quit, we quit arguing about it. And that was a lot more likely to open someone up to the idea of it because they don't feel like they're being pointed out as the only bad guy. and forced to do something. That worked really well. Now, these days, what I teach family members is a lot deeper than that. It's how before you even try to get them to come in the door, get them ready. Like, get them ready in the stage of change you want them in. And so that worked at the time, but these days is sort of more involved than that.
So there's a theme that I'm hearing in your approach, both with family members and with how you're having family members approach their loved ones, and it's a humility. It's a this as a therapist, you're not when you're telling the family members, hey, I need you. I need your perspective. You're not telling the family members, "Hey, I went to school and I have the degrees and I have the license and and
Mm-mm.
I'm the expert and you need to listen to me." And what you're helping the families learn to do is to make it a we instead of
Yes.
a finger pointed. And so there's the theme I'm hearing is this place of humility,
Mhm.
that says rather than forcing, rather than this shoving, or standing over and pointing a finger.
Right, which comes across as to the person, it comes even though it's come from a loving place, it comes across as judgmental and critical and controlling. And so that actually impedes the counseling process even if you get them to come in. If you got them to come that way, it's like, I'll tell these families, I'm like, "If you do it that way, I'll get your person, but it's gonna take me 6 months or maybe more to get them through those first stages of change, even to the active stage of change, and in that 6 months, you know what they're gonna be talking to me about? You. They're gonna be complaining to me about you, and I'm not gonna get them to talk about anything else until I get this fixed." And the bad thing about it is family members wanna usually pay in it, so I'm like, "You don't wanna pay me to listen to your person complain, like, let's get this problem nipped," you know? Yeah.
I love that. So let's, because we're coming to our last several minutes, and I want to make sure before we go anywhere, and as a person who's been that family member, man, I want to know, how can I learn if I'm a family member and listening to this and hearing you, how can family members learn more about this? How can they find your YouTube? How can they find your your blog and things?
Mhm.
How can they find out more about you in this work?
Sure. Well, of course, I'm on the social medias. I have a website, but the best place to find me is on YouTube. I would consider myself a YouTuber these days. That's my main platform. And the channel, it's got a strange name, so hopefully, it'll stick with you. It's called Put the Shovel Down. And that is an old recovery saying, and it means you hit your bottom when you put the shovel down. So quit digging. You don't have to burn all your bridges. You can be done whenever you decide it. And so you can find me on YouTube. You can search my name up on any platform and I'll come up, but YouTube is the best place. There's more than 1,000 videos there.
Like I said, I got looking at it today, and oh my goodness, there's a lot, and there's a lot of really important, people can get more of the details of how you actually can help yourself as well as your
Mhm.
loved one. It's, we remember that we treat a chronic illness, and all
Mhm.
chronic illnesses, whether it's diabetes or whether it's addiction or whether they all affect the family, and the
Right.
family affects and so everyone's affected, everyone deserves recovery.
Absolutely. 100%. I'm with you.
So before we get to my last question, because I always like to, as the last question, we like to let you, I'll give you a little advance notice. We like to let
Mhm.
you just have the last word. And we
Okay.
like to let you give the last word to our audience. But before we get that, I wonder if we could talk just for a second. You mentioned, when I used to do this work exactly like this, and it's changed. How do you see the work of psychotherapy, the work of addiction counseling, the work, how is that or changing in general from your perspective?
Well, I can tell you how it's changed for me. I don't know
Yeah.
so much if I can speak for like the whole field or whatever, but these days I don't even do
The
counseling
pressure's
anymore.
on.
Right? I just do coaching and consulting because, well, one, because we work with people all over the world, but also because when people come to see me, they want to know, what do I do? And so I'm like, say this, do this. It's very sort of directive as opposed to how does that make you feel kind of thing. It's like, all right, here we go. We're in this team. We're going to fix. So I do coaching now, but I see my job primarily is helping to motivate people to do what needs doing, whether that's the family member or the person with the addiction. I don't see my job as telling people how to get sober. That's pretty simple and clear. Like, it's not that complicated, and people always know what they need to do, and they've already figured out what's going to work for them and how they would do it. And, some of that's trial and error, but they know their answer. It's about getting them to decide to take that answer. So I spend hardly any time telling people what they need to do it. It's about helping to bring them along in those stages of change and then just being their like cheerleader the whole way while they do.
I love that. I always tell people, I am not in the exact physical shape that I want to be. And it's not because I don't know how to. It's not because I don't have right. I don't need anybody to tell me that I need to exercise. I don't need anybody to tell me that there's there's a treadmill next to my bed, right? I have the knowledge. What I need is help with that motivation to do what I already need to do. And that's what you're seeing is in your own practice. I love that. It's beautiful.
Yeah.
So
thank you.
let's take this moment. First of all, thank you so much. And remember, everybody, it's put the shovel down. That is, I loved the name as soon as I saw it. Encourage everybody to check Amber out, check out the material that's out there. And Amber, we like to, like we said, let you have the last word. The audience, we're told, is really varied. It goes from professionals to non-professionals to people interested in mental health or addiction. And so this wide variety of people are out listening. And what is one last thing that you would like to hear them to hear from you today?
People to stop listening to all the negative statistics. I feel like the way we sell recovery is terrible these days. We say, your brain is broken and you got this for your whole life and you're going to be doing recovery forever. And all these things, you're going to have to give up all your people, places, and things. Well, that's like a terrible way. And then we say, and only 10% of people make it. And if you're not willing to do everything I tell you, you're not going to be one of them. That's ridiculous. First of all, that's just bad marketing. So we can do better than that. And it's just not true. This idea, this 1 in 10 or whatever idea, because the thing of it is it takes people multiple times. So yeah, if I looked at 10 people whose first time it was in a treatment center, maybe one of those people would be sober in a year. But if I followed those 10 people, I guarantee a lot more because it takes more than once. It's a learning process. It's a trial and error. And so I feel like people get discouraged by that. People get beat down by that. But I want people to know better and that you're not powerless. And there's a million things you can do. And there's a million ways to do it.
I love it. Thank you so much for that word. And again, for that theme of, humility. I think it's a good reminder for counselors and therapists and coaches and everybody to approach things with a little bit of humility. That's what I'm going to take away from this today. Amber, thank you so much for being here. Thank you for your time. I can't believe it just goes so quickly, but I appreciate it. I hope everybody will check you out. And I just want to say thanks to everybody for either watching or listening today. We'll see you next time on The Hanley Effect.
Thank you for joining us for The Hanley Effect. To learn more about our programs, visit hanleyfoundation.org or call 844-502-4673.